Buongiorno a tutti e benvenuti anche oggi allo spazio dedicato alle interviste di Holistic News. Oggi con noi abbiamo il dottor Nambi direttamente dal Kerala in India. Good morning, Dr. Nambi.
Sì.
Il dottor Nambi è una delle figure di spicco dell'Ayurveda, è un insegnante, medico e ricercatore. Per questo motivo viene chiamato in tutto il mondo in qualità di esperto. Ha una carriera clinica che si estende da oltre un decennio, diretto successore di una grande famiglia di Ashtvedias, le più celebri famiglie di medici tradizionali in India, che hanno un lignaggio di secoli. È noto come rigoroso sostenitore dell'Ayurveda classica e le sue presentazioni riflettono fedelmente i valori fondamentali dell'Ayurveda. Attualmente è direttore della divisione accademica dell'ospedale ayurvedico e centro di ricerca SNA in Kerala, che accoglie pazienti da tutto il mondo. I made a small presentation about you, but it's difficult to summarize your wide and brilliant professional profile. So,
Okay.
Dr. Number, I would like to ask a question for our followers. And just how did you spend this lockdown period?
Actually, in India, the lockdown started in March 24th, still not completed. Expected to finish our lockdown in next week. The first week of lockdown was little bit difficult to all of us, including myself, because it was a time just our life to reschedule. But fortunately, in the later weeks, we realizes that we have to stay in, not out. So if we are not able to go outside, so I have decided to go inside. I mean to say, not only physically, also mentally, also spiritually, so that decided to travel inside. And my life was much better now because I spend more time for finding time for doing yoga, doing meditations, follow some of the dinacharya, the daily routines of Ayurveda. And most importantly, I am getting time to spend with my wife, who is a doctor, Ayurvedic doctor, and my children, to whom I just started teaching Ayurveda, though they are just age of 10 or 12. So what I mean to say is that lockdown given me a lot of values in my life, which I could have not able to attain by any cost, because normally this will not happen because of the hectic pre-designed schedules in our life. As I mentioned before, in the first week was really, it took time to adjust with that. But later on, everything is going smoothly, except you are not able to go outside. And that was the period happened in the next 4 weeks. So from the last 2-3 weeks, as a medical doctor, I have been permitted to make consultation with the patients, and I can go out if there is a necessary visits. And this period was very challenging. For example, few distance away from my house, a lady age about 90, she had a semi-fainting, and the family members rushed to my house and asked me, can you help? So I went there and checked the routine way. The symptoms was very much suspecting to that of sodium potassium variation, but unfortunately there was no much hospital nearby. There is no lab to check. So I decided that, okay, with the idea of Ayurveda, I tried to give something to improve the sodium and potassium, like some fruits and some juices, and it worked well.
Yeah.
So this was also an experiment in my life to develop my clinical skill and also challenge in my life.
Yes. Very, very interesting. And we always thought that in order to healthy, it was necessary to have a correct diet based on foods rich in nutrients. But Ayurveda believe that how we digest is much more important that we eat. Now that in Italy we have come out from the period of lockdown, about food and digestion, what advice would you give us to metabolize this situation?
Actually, uh, now after the lockdown, most of the people really has to retrospect their life and they have to redefine their life, not only the physical outside level, also from inside level. Why? Because maybe in many centuries we human being lived human centric life, and we believe that if we are healthy then everything is fine. We are not bothered about the nature, we are least bothered about the environment, or we are not much bothered about what other creatures outside. But very unfortunately, this reached into a threshold point, and nature taught us that when we withdrew back, nature started reviving, revitalizing. This means that it is very strongly, it can give a message from the nature that we have to tune with the nature as much as possible. In that aspect, we we had to rethink our personal health into a universal health, one health, that health connecting to all the creatures, all the everything in the universe, because we are all like one family. Even though things happened in China from the Wuhan, now within weeks it came to Europe, it came to India, it came to United States. So we are all just one family, and if we try to find our own balance, then only we could able to find individual balance. For which food is one of the major important thing. We believe that if we have enough nutrients like carbohydrates, minerals, proteins, metals, fresh vegetables, fruits, we are healthy. But no, if even if we take all these things, we failed in combating many diseases because what we digest is much more important than what we eat. So what defines the digestion? In Ayurveda, we call Agni, the digestive capacity. And what is the outcome of that content is very, very critical in a person's life. So that was the major topic I'm going to speak in this conference, which is going to happen in coming Saturday and Sunday with in the Ayurvedic school, Ayurvedic point. Of course, I was speaking there in the last 17 years continuously in Milan, and this year, very unfortunately, I was not able to present there physically.
Yeah.
So this topic become very important because few reasons. We believe that we want to be, we are healthy, we want to be healthy, and we want other people to be healthy. But what determines the health? We thought good food is enough. We thought, okay, we have very nice purified water. We are happy. No, there are so many other things in the life that will have harmony outside that can contribute and that can determine our health. So there are so many determinants besides our this physical body outside. It may be the nature, it may be the water, it may be the plants, animals, whatever. And fighting with them, defending with them is not the solution. We have to find a relationship between them very harmoniously. Neither we distract them nor they distract us. Rather, we live in a very hostile environment. This will be very important how we make a relationship with anything in the universe. That adaptability from what and what not outside is in Sanskrit terminology as paka. That is the transformation, how we transform things. So, in this context, I'm going to speak that we have to expand our consciousness from this physical body to a universal dimension so that we'll be able to be more inclusive, including the coronavirus, I believe.
Yes, yes.
Because we want to include, it is also a product of nature. We can live with that. Let that not disturb me. Let I don't disturb them. That could be the ideal way in the universe to live, which is largely made wrong by human because of our ego. So this lockdown is a best method. We have been given time to melt our ego and redefine our perception of ourselves versus the universe. And
Absolutely.
keeping this idea, I'm going to speak about Paka, how we tune with the nature. It's not, we cannot say that I am Indian, you are an Italian, you are a Chinese. No, we are all together. We are all just one. We have some physical bodies and situated in different part of the world. If we are able to have a harmony, then everything goes smoothly. So that will be my topic of presentation, where I'm trying to speak beyond food. Food will be one topic, but it's food is not only that we consume, rather what we see, what we smell, what we eat, hear is also a food. It is a food for the sense organs. So, and also from the mind, from the manas perspective. So in this seminar, I'll be speaking more deeper aspects of a person's food, nutrition, and metabolism beyond gut. I would like to speak about the universal gut, a gut that tries to help the metabolizes the things.
Yeah. So, I'm going to remember in Italian that il dottor Nambi farà appunto questo seminario online aperto a tutti sabato 16 e domenica 17 maggio e verrà tenuto in lingua inglese con traduzione in italiano. Thank you very much, Dr. Nambi, for the helpful advices. Thank you again for being with us e grazie a tutti voi per averci seguito.
Thank you so much.